In maternity wards around the world in the early 60s, thousands of babies were being born with severe birth defects. In some cases, hands and feet were sprouting directly from the torso, and even when limbs were present, they could be deformed to the point of being non-functional. Many babies were lost in stillbirths, while many others did not survive their first year. It all happened despite the fact that parents had done everything right during pregnancy, and it got them thinking about what they'd done to deserve this. Doctors couldn't explain it either, and hospital workers thought it might be caused by radiation or some strange viruses. But it wasn't those. The culprit was a pill mothers consumed during pregnancy, a pill that was advertised as perfectly safe. That pill was thalidomide. Thalidomide was supposed to be a harmless sedative. The company's representatives claimed it was completely safe, so safe that even pregnant women could take it. So safe, doctors began prescribing it to ease morning sickness. A miracle of modern science, they said. The wonder drug, they said. It turned out to be less like a wonder and more like a slow-moving disaster with lifelong consequences. Everything began in the 1950s, in an era known as Wirtschaftswunder, or economic miracle, an era when West Germany was rebuilding from the war. Its economy was climbing rapidly, and there emerged a new kind of optimism for both science and modern medicine, as the demands were increasing for medications that promised to cure anxiety and help people sleep, especially in a society that was still grappling with post-war trauma. Among the companies riding that wave was Chemie Grünenthal, a company founded in 1946 by the Wirtz family, who until then had been in the soap and perfume business. But after the war, West Germany was desperate to rebuild its pharmaceutical industry. And when private firms were allowed to make penicillin, Grünenthal was one of the first to get a license. And that gave them a foothold in medicine they otherwise wouldn't have had. They made antibiotics as their starting point, but they realized that antibiotics alone weren't going to make them big. So by the early 50s, they began experimenting to invent a signature product that would carry their name even further. This is where all the nightmare began. Because the people running Grünenthal were not just ambitious businessmen. Their first head of research, Heinrich Müchter, was a physician who during the war conducted typhus vaccine experiments on concentration camp prisoners in occupied Krakow, which many of his subjects died as a result. And after the war, Polish authorities tried to extradite him for prosecution, but he managed to escape into the British zone and avoided trial. He eventually surfaced at Grünenthal and was put in charge of the company's laboratories. Several other Grünenthal senior figures also had Nazi backgrounds, with some having direct ties to wartime atrocities. Otto Ambros was one of them, a chemist who was convicted at Nuremberg for his role in IG Farben's chemical weapons program and for exploiting forced labor at Auschwitz. He served only a few years before being released and re-entering West Germany's chemical industry, where he later worked as a consultant to Grünenthal. Not to mention the company's founder Hermann Wirtz, who was also a former Nazi member. Though he wasn't a high-profile figure like Müchter or Ambros, his background showed just how deep the ties were between the Nazi regime and Grünenthal's leadership. And it was this very culture of impunity and disregard for human safety that would shape the company's most ambitious project. Between 1952 to 1954, Grünenthal was experimenting with new sedatives under Müchter's direction and supervision. The company was chasing a specific goal to create a modern tranquilizer that seemed safer than the barbiturates. Barbiturates had been around since the early 1900s and were widely prescribed, but they came with some obvious risk, such as overdose and addiction, and even in some cases they could cause fatal respiratory depression. Due to the long list of barbiturates side effects, doctors at the time were eager to have an alternative, so were the companies trying to sell to them. And with those motives in mind, the company synthesized a new compound called alpha-thalimidoglutarimide, which they later renamed thalidomide. Early in-house testing suggested it was promising since the compound didn't kill rodents or rabbits even in high doses, indicating that it could be labeled as non-toxic. And when it was tested on small groups of human volunteers and patients, they gave the kind of feedback the company wanted to hear. People said it helped them sleep, and did so without the heavy hangover effect that came with older sedatives. For a company desperate for a flagship product, this was gold, since thalidomide could be pitched as the modern answer to stress and sleeplessness in a rapidly modernizing country. But the reality was more complicated than that. Those tests were narrow. Those were rudimentary and only focused on acute poisoning. They didn't measure long-term effects and even completely skipped reproductive studies on pregnant animals. That oversight alone left a blind spot large enough to kill thousands of fetuses. Therefore, the company never discovered a critical fact that a single dose of thalidomide could inflict its most devastating effects during the first trimester, especially when limbs and organs were forming. And if taken later in pregnancy, it might have done no harm at all. But despite all that, the company moved ahead and began selling thalidomide onto the German market on October 1, 1957, and critically, it was sold over the counter, which made it as easy to buy as aspirin. Their commercial strategy was equally aggressive. Within a very short time, the company licensed production and handed the formula along with the marketing playbook to other firms around the world. Thalidomide was sold under license in 46 countries by about 14 different pharmaceutical companies under at least 37 trade names. In Germany, it was Contergan, in Britain, it was Distaval, in other parts of Europe, Softenon, and in the United States, it would be packaged as Kevadon. The messaging of their ads was clear and simple, that this was a modern sedative without the risk barbiturates had. In Britain, for example, distillers as the licensed distributor marketed the drug in which, I quote, "Distaval can be given with complete safety to pregnant women and nursing mothers without adverse effect on mother or child." That same message was being used in many other Commonwealth countries. And in 1958, Grünenthal partnered with the William S. Merrill Company to bring the drug into the US market. Merrill filed an application with the FDA and at the same time began distributing tens of thousands of sample tablets to American doctors for what were called clinical trials. This was a common loophole back then, that companies could label drugs as investigational and cede them to physicians before final approval, a practice that recklessly exposed patients to new chemicals long before the regulatory process was complete. This application file was assigned to Dr. Frances Kelsey, who was a newly appointed medical officer at the FDA. She studied pharmacology at the University of Chicago and already knew from experience that drugs which seemed harmless could carry hidden toxicities. So when she opened the Kevadon application in September 1960, she immediately noticed something troubling, that the claims of safety weren't backed by reproductive studies or long-term toxicology, just a bunch of loose testimonials from doctors who had handed out samples, not from rigorous data. And over the following months, Merrill's representatives pressured her relentlessly. They complained that Kelsey was being overly cautious. At one point, the company's executives even appealed over her head, arguing that the drug was already sold in 46 countries, so why was the United States being held back? But Kelsey kept returning the application with demands for controlled studies, particularly data on effects in pregnancy. Meanwhile, those samples were already and still out in the public. By early 1961, an estimated 2.5 million Kevadon tablets had been distributed to more than 1,000 physicians across the US, and roughly 15,000 patients had taken them, including several pregnant women. At least 17 American children were later confirmed to have been born with thalidomide-related defects according to the FDA. But a journalist and novelist, Jennifer Vanderbees, has found there are about 100 survivors still living today, and that doesn't include all of the babies that were stillborn or died a couple of years into their lives. And while all of that was happening in the US, pediatrician Widukind Lenz in Germany had pieced together the link between thalidomide and newborn deformities. In November 1961, he confronted Grünenthal directly with his findings, which then forced the company to pull Contergan from the German market on November 26, 1961. And around the same time in Sydney, Australia, Dr. William McBride, who had been prescribing the drug to ease morning sickness in his patients, noticed over the next few months that a rising number of infants were being born with phocomelia, a condition in which their limbs were drastically shortened or absent altogether, and in some cases, hands and feet sprouting directly from the torso. He then put his findings into print, and on December 16, 1961, The Lancet published his brief but devastating letter. Congenital abnormalities are present in approximately 1.5% of babies. In recent months, I have observed that the incidence of multiple severe abnormalities in babies delivered of women who were given the drug thalidomide during pregnancy as an antiemetic or as a sedative to be almost 20%. These abnormalities are present in structures developed from mesenchyme, i.e., the bones and musculature of the gut. Bony development seems to be affected in a very striking manner, resulting in polydactyly, syndactyly, and failure of development of long bones. What he wrote in this publication wasn't a full study, nor did it have statistics comprehensive enough to definitively prove the link. He even asked if his readers had seen similar abnormalities in babies delivered of women who have taken this drug during pregnancy. But this was all it took to expose the whole scandal. The appearance in The Lancet gave scientific credibility, which then forced doctors around the world to reconsider a drug they'd been handing out casually. Historians now estimate that more than 10,000 children were affected globally, with thousands more miscarriages or stillbirths suspected. Some even cited around 20,000 babies affected, with nearly 80,000 deaths. Numbers varied depending on sources, but one thing was certain, that thousands of the infants who were born alive did not survive their first year. And by the time the American press picked up the news from Germany and Australia, Kevadon still wasn't approved by the FDA, and only then did the company quietly withdraw its application. The press around the world, which had once repeated Grünenthal's advertising lines, now turned on the company with anger, demanding answers about how such a drug had ever been allowed onto the market. And they demanded justice. That demand led to a trial, but the proceedings, which began in May 1968, quickly became a contest of legal and technical arguments. The company's defense stressed that regulatory standards and routine reproductive or teratogenic testing were underdeveloped in the 50s, while on the other side, prosecutors struggled to prove any criminal negligence against individuals under the law and evidence available at the time. Only 9 employees were charged, yet none were ever convicted. Because in December 1970, the court prematurely dismissed the criminal case, citing insufficient evidence of personal culpability. The judges concluded that continuing the proceedings was no longer in the public interest, a phrase that essentially meant it wasn't worth pushing the criminal trial any further because it was dragging on too long and becoming too expensive, and in their view, unlikely to produce any convictions. But that's only part of the truth. As reported by The Guardian and Reuters in 1969, the company's directors quietly met with government officials to discuss a quote-unquote overall solution, since the company was worried about open-ended liability and the reputational damage from the constant negative headlines. And on the other side, the government was anxious as well, especially about West Germany's pharmaceutical industry as a whole, which was booming at the time and was politically sensitive. So the longer the trial continued, the more damning evidence about the scandal would be revealed. Not to mention Joseph Neuberger, who, before entering politics, was one of Grünenthal's defense lawyers representing Hermann Wirz. And in 1966, he became the Justice Minister for North Rhine-Westphalia, the very state where the trial was taking place. And if you think about it, the man who had once defended the company now had political influence over the prosecutors pursuing the case, which was a glaring conflict of interest. And in early 1970, prosecutors drafted an analysis of whether the case could be dropped or not. Because under German law, a trial could only be terminated if the accused was considered to have quote-unquote minor guilt, and if ending the proceedings was clearly in the public interest. Their own draft admitted neither condition was really met since the guilt wasn't minor and the public was still demanding justice. But despite this, and under clear political pressure from ministries, and with the justice minister himself once tied to the company, prosecutors leaned toward shutting the trial down anyway. This move was all the more outrageous after documents from inside the company showed how much and how early the company already knew about the risks. Because in October 1961, one of the company's trainees working in scientific sales division wrote a note acknowledging that thalidomide had intrauterine effects, which meant that it could cause severe damage to a developing fetus. And years later during the trial, he sent a registered letter to a government minister dated January 26, 1969. In it, he wrote about what he had seen with his own eyes.
We were shown a packaging unit for Contergan with the sticker "Not for pregnant women." The management knew about the damaging effect on fetuses at the latest by mid-October. The decision to carry on selling the preparation was without any doubt motivated by profit-making and criminal in my view.
Let me repeat and be absolutely clear about what this meant. A company trainee saw a proposed warning label in mid-October 1961, and for weeks, through the peak of the holiday season, they kept selling the unlabeled drug that could be bought as easy as buying aspirin, merely because they wanted to generate more profit, even as more reports of affected newborns came in. This was no longer negligence. This was, as their own employees stated, criminal. So how? Just 9 years later, did the German justice system concluded that holding anyone accountable was no longer in the public interest? It sounded like the state was saying, this case is too expensive, too damaging, too politically messy, we'd better bury it. And with that ruling, the path to justice was officially closed as the matter was moved from the courtroom to the backroom. Instead of justice, affected families got a settlement fund of 100 million Deutsche Marks to establish a foundation for victims, with the federal government later adding funds of its own. And the 9 employees charged with intent to commit bodily harm and involuntary manslaughter walked away free, without any convictions. Decades later, in September 2012, Harold Stock, as the company's CEO, stood before a memorial in Stolberg, Germany, and delivered the company's very first formal apology. He asked for forgiveness, saying that for nearly 50 years Grünenthal had not found a way of reaching out from human being to human being. The apology was rejected, because for the survivors it felt like too little, too late. Many of them criticized the language, the careful sidestepping of responsibility, the lack of wider acknowledgement of guilt, the fact that physical and emotional suffering had never really been addressed. For people who had spent a lifetime overcoming the obstacles the company placed in their path, the apology felt like an insult. Grünenthal had spent those decades rebuilding itself, becoming a pharmaceutical giant. While they treated the tragedy as a regrettable chapter, they were eager to close. The victims were condemned to live this reality of daily torment, one the company's executives could never comprehend. They were robbed of the choice of a normal life, while the men responsible insulated themselves from the slightest flicker of the agony they had manufactured. They moved on with their profits secure, waiting for the world's memory to fade, before having the audacity to stage this hollow, calculated apology. But no apology can ever erase decades of life defined by disability or the profound humiliation of being treated as collateral damage. The thalidomide scandal was always a moral catastrophe instead of medical. That corporations will just gamble with human lives when it comes to profit. This was not the first time that a wonder of modern science ended up in tragedy. Less than 4 decades before thalidomide, a generation of young women in the United States were poisoned with radioactive material because their bosses asked them to put it into their bodies, telling them it was completely harmless, all to save time and material so the company could generate more profits. The very bones of these young women became radioactive and will continue to do so for centuries to come. Those young women were known as the Radium Girls, the women whose determination, even in their suffering, shaped the modern workplace safety standards we have today.